We're starting to reach outside the four walls. Nobody does that better than Amazon, reaching outside the four walls of the building and really engaging people where they live and giving them experiences that delight them. As we start to think about that in healthcare, what kind of experiences might we give them that they would walk away and go, yeah, that was a delightful experience? Are we starting to see some of those things or enable some of those things, or do we still have some ways to go because of the nature of the data and the nature of interoperability?
Well, the patients and consumers, I think, are defining and driving sort of the advances that we all hope to see. They, in fact, are helping healthcare as an industry think about what it is that's most important for them. And I think we've heard loud and clear during the pandemic that location agnostic care is really critical, and also being able to distinguish between the kinds of care that really require, coming into the four walls of a clinic or a hospital, and those that actually can be done perhaps even better through virtual health modalities. And so in that context, as we begin to move in those directions, I think we've really advanced quite a lot in those areas. At the same time, what we're seeing, and one of my favorite things that happened during the pandemic is we started to see health systems really say, you know what, we have all of this data and we've got to start to understand the data so that we can begin to predict the kinds of interventions that we really need to be having.